My name is Dr. Michael Wald, and thank you again for attending what is the 7th presentation in a 13-session, 1 hour per session Master's Health and Nutrition course. This course is free, and you can find this and other editions of the show on prnfm.com and also on my website, drmichaelwald.com. That's me, Dr. Michael Wald. Or you can go to intmedny.com or drmichaelwald.com. So for those of you new to this presentation series and to PRN, again, my name is Dr. Michael Wald, and I host a 1 hour show every Saturday entitled Ask the Blood Detective. And the purpose of all of these topics, at least in my mind for you listeners, is that you become better blood detectives for yourself. So your own personal blood detective, your ability to cut through a lot of the ridiculousness out there, a lot of the wrong information, and to know a little bit more than maybe those around you. So again, that you can make better healthcare choices. And as I've mentioned during my previous talks, this talk, along with others that I've presented, are basically identical to the talks that I have given to health professionals. So these slides are the very same ones that I've used with health professionals. I find that if I can challenge you just a little bit to reach up here, rather than settle for this, maybe you won't get all the way here, but you might get here. But if we shoot for this, you might get there. So if that makes any sense to you, I want to make you better. I want to make myself better. This is why I do these presentations. So today's topic is the truth about pH and detoxification. And of course, I need to start with a bit of a disclaimer that this information is for your education only. It's not meant to substitute for sound medical or natural health advice. And any use or misuse of this information is on you. So don't mess up. It's best to, of course, work with a qualified health professional if you have an interest in this topic and health issues that you feel might relate to toxicity, the process of detoxification, and to pH balance. And when you do search for a qualified health professional, you might want to compare them to my credentials here. I have a Doctor of Chiropractic degree and MD diploma. I have a Master's in Human Nutrition along with a PhD in Philosophy of Holistic Health. I am a dietitian as well as a certified nutrition specialist. Those last two, the dietitian and certified nutrition specialist, are certifications recognized by New York State. So if you're going to look for a health practitioner to work with, you want to make sure the credentials are real. And then I'm a sports nutritionist and a physical trainer. So all of these areas I have felt have helped me help you and my patients better. The more I know, the better I can be. Now, before we can have a conversation about pH, we need to define pH somewhat. And I first want to let you know that every organ you're looking at on this screen, whether it's the thyroid or the heart or the liver or the lungs or the arterial system or the venous system or the lymphatic system or the hormone secreting endocrine system, the small intestine, the large intestine, you name it, all of these tissues have a role in managing pH and detoxification in the body, more or less in different people depending on their health problems. And we'll talk about specific health problems and how they can lend themselves to toxicity issues, and in particular, which is the main focus of this talk, pH issues. But I do want to drill this particular slide home that, many people out there, they don't think that the heart, let's say, has anything to do with pH in the body, but the heart has to do with circulation. Circulation has to do with oxygenation, and oxygenation very much has to do with pH balance and toxins. Even the lungs, especially the lungs. If someone has an issue breathing, it might just be anxiety, where they don't breathe out as much as they should, and their breathing is shallow because they're anxious or in pain, for example. The body would retain carbon dioxide. Carbon dioxide is slightly acidic, and that can cause a systemic or metabolic acidity or acidosis, as it's called in the body. And if the reverse was true, where you were breathing out excessively, you might develop a metabolic alkalosis, which has to do with alkaline. So let's define detoxification. Another word for detoxification, by the way, is detoxification. This is not a typo here on the first line. And basically, detoxification is the removal of toxic substances from the body. And you should know too, bullet number 2 here says that there's urine pH, and the urine pH on average should be about 5.8. And that has to do with pH with what we're eliminating from the body. And it's important that the urine pH is a certain pH when we're trying to eliminate certain things, because if, for example, the pH were too high, then we wouldn't be eliminating heavy metals, let's say like cadmium, lead, or mercury very well, because they require an acid towards the acid end of the pH scale in the urine. And then we have saliva pH, which generally should be about neutral, which is a pH of about 7. And saliva tells us about the tissues in general, the lymphatic system, and something known as the interstitial fluids and their balance and their contribution to the pH. And what's very important here is that the last bullet, where it states that the urine and saliva pH are not as accurate as blood pH for overall health problems, generally speaking. There are exceptions. For example, if someone has repeated urinary tract infections, generally their pH is too alkaline. You heard that right. Alkaline is not always good. If the pH is too high, then people can get urinary tract infections. That's why taking acidophilus or acidophilus, because that probiotic acidifies the urine, can help get rid of about 30 to 40% of urinary tract infections. So when I'm talking about pH during this presentation, unless I state otherwise, we're talking about blood pH. We're talking about capillary pH, arterial pH, which you can consider the same thing, and venous pH, because the venous pH and the blood arterial pH are almost the same. So I'm basically going to say blood for the purpose of this conversation, but you need to know that the blood pH is relatively stable. When there are changes in blood pH, either too high or either too low, serious problems in health can occur. But the saliva pH and the urine pH, they change all over the place on a whim. I can have you jump up and down and change your saliva pH and easily make changes in your urine pH as well, but not the blood. The blood is a very tight range of 7.35 to 7.45, or on average 7.4, generally speaking, is where your blood pH should be. Practitioners that overemphasize saliva and urine usually don't have the license. Their credentials don't allow them to draw blood like mine do, so I can use the right testing. So what is blood pH even for? Well, first of all, it has to do with acid-base balance in the body. And as I mentioned just a moment ago, our ideal pH should be about 7.4. pH that is too low or pH that is too high can definitely be problematic, because pH also sets the environment in the body for various enzymes to do work. Enzymes run various metabolic reactions that allow for all healing and homeostasis to happen. If those enzymes, which are pH dependent, are not swimming in the right pH, then we're going to have a problem. And depending on the individual, they will have specific health problems. And then our bullet number 3 here, that, as I mentioned, acid-base imbalances can lead to diseases of all types, from cancer to autoimmune disease to heart disease, lung disease. Again, you name it. There isn't any health condition that escapes from being dependent on pH somewhere along the line, if not in many areas. And then there are metabolic functions in the body and enzyme functions. So as I just mentioned, enzymes run the rate of reparative reactions in the body. And those enzymes are protein-like structures that require a proper pH. Depending upon where in the body we're talking about, there may be a slight difference in the pH required. And then there's energetic and other corrective metabolic pathways in the body. For example, like glycosylation that has to do with, or glycolysis, I should say, which has to do with glucose metabolism. That's pH dependent. As you might imagine, too much sugar might cause a lowering of the pH, which would have an adverse effect on glycosylation in the body and blood sugar. And then there's something called organic acid pathways in the body. They have to do with producing ATP, or energy molecules. And if those enzymes in this metabolic pathway, for example, organic acid pathway is like a big clock, and it goes through different enzymes here, 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 here. And these enzymes require proper pH. And then there are the very important, what we call cellular pumps. So in cells in the body, think of a cell as a circle, there are pumps in the cell membrane. If these pumps are not working correctly, because of pH problems, we're going to have problems maintaining the health of that cell. That could lead, again, to cancer or any sort of breakdown of that cell. That could be a muscle cell, a brain cell, a thyroid cell, you name it. And then respiration, how we breathe, has an immediate impact upon the systemic pH. So if I were to ask you to breathe out more than you're breathing in all day long, the breathing out would cause you to blow off carbon dioxide. Now, since carbon dioxide lends acidity to the body, your blood might be too alkaline if you're hyperventilating to the point where you have excessive expirations. On the other hand, if you're deep breathing and you're not blowing out enough of the CO2, that can cause a lowered pH in the body. So a low pH is on the acidic range, a higher pH is on the alkaline range, then there's 7 in the middle. The pH scale is 0 to 14. 7 is neutral, water is neutral. You want to be 7.4. Every 0.1, did you hear that, folks? Every 0.1 difference in pH is 10 times abnormal. So 7.4, which I said you should be at, if you're 7.3, that's 10 times too high in hydrogen ions, which cause more acidity towards the low end. And if you were 7.4, let's say 7.5, that would be 0.1 greater than 7.4, which would be 10 times higher in hydroxyl radicals in the body, which cause more alkalinity. So we need to be in that sweet spot, depending on what we're doing. Sometimes there are exceptions where we want to lower the pH to do something temporarily in the body. We want to increase the pH to do something temporarily. So this concept that you've all heard on we should be alkaline in our bodies makes absolutely no sense once you learn just a little bit more chemistry. But I'll explain it to you right now, as I've done on several of my radio shows on Ask the Blood Detective on PRN. And that is that if you say that we should be alkaline, where should we be alkaline? Well, we should be alkaline in our mouths because the alkaline enzyme amylase that breaks down starch is active at an alkaline pH. Then our stomach should be acid, not alkaline. We all know that, right? We secrete stomach acid. We can't break down proteins without it. We can't break B12 from protein in the diet without stomach acid and acidity in the stomach. We can't take calcium and ionize calcium so it's used and knows where to go in the body. And then our small intestine should be slightly alkaline, our large intestine slightly acidic, our blood pH to the left of neutral at 7.4. So this we should be alkaline makes no sense. And should you eat an alkaline diet? Hold on for that. Okay, and then there's the neuromusculoskeletal system. Its use of oxygen through its heavy need for circulation obviously can affect one's pH in the body, particularly in the blood. And any adjustments to venous or arterial oxygenation can certainly impact directly problems with pH, lymphatic problems, intestinal function problems, and hormonal problems. All of these and many other factors can control pH, far more than just diet. And diet, by the way, does not change the blood pH much or at all in the short term. It takes several months to years in some people to adjust the pH of the blood through diet. It's easier to lower the pH of the diet with acidic foods like animal products like red meat, which are high in arachidonic acid, but very difficult to eat foods that are supposedly alkaline to raise your pH. Not that we're not going to talk about clean diet and eating, but there's much more to pH than you probably have thought. So that leads me to some misconceptions that I'm going to share with you about pH. I'm going to ask it as true or false questions, then I'm going to give you the answer. So for example, true or false, if you eat alkaline, you will become alkaline. False. We just explained it. If you eat alkaline, that means eating foods that if you ground them up in water and put a pH stick in them, they give you an alkaline pH. If you ate that, would those alkaline foods make you alkaline? Well, again, where are we talking about? The answer is no. You can eat alkaline foods that help your body make stomach acid. You can eat alkaline foods that or acid foods, on the other hand, that can help make certain aspects of you alkaline. Let's go through this and you'll understand a little more in detail. So if you drink alkaline water, you will alkalinize your body. Well, that's not true. If you drink enough alkaline water, could you increase the pH of your blood? Yes, you'd have to constantly drink it though, because the sodium bicarbonate, which is used to alkalinize water and charge all that money for, only changes the pH in the body for about 5 minutes or so. Even intravenous sodium bicarbonate only lasts about 15 minutes once you stop the IV. So you'd have to drink alkaline water like constantly to make your pH alkaline, or on the alkaline end, let's say as high as maybe 7.5, 7.6. But when you get beyond 7.45, or you get lower than 7.35, serious health problems can happen. If you have cancer, however, and you're trying to alter the blood pH to make it more alkaline, it is possible to do that with a combination of alkaline water. But for those of you that don't have that issue, you are going to cause, by drinking alkaline water, low to no stomach acid. You're going to dilute it all in alkaline water, and you won't digest properly, so you'll be malabsorbing, and therefore you'll have malnutrition. So that's a problem. More about alkaline water later. If you eat protein, which are acidic foods, you will become acid. That's mostly false. Your body controls your pH in your blood so closely, it will not change from a diet like that. However, could you change your saliva and urine pH by eating acid and alkaline foods? Yes, but they don't have the effect on the body's health as you might have thought when we started to begin this conversation about pH. So here's another misconception. There's no difference between saliva, arterial, stomach pH, all these different pHs. Obviously that's false. We just reviewed that we have an alkaline pH in the mouth. We should have an acid pH in the stomach. We should have a slightly alkaline pH in our small intestine, slightly acid pH in our large intestine, etc. And our blood should be, again, just left of neutral at about 7.4. So the next to last bullet, a balanced pH is always within defined physiologic ranges. Oh, that depends on the body you're talking about and where in the body you're talking about. So if you need a balanced pH in the stomach and you have low stomach acid, taking something like red wine vinegar, for example, which is acid, will help you digest and will acidify your stomach. So you'd have to do that with every single meal. And then our last bullet, foods are the best way to quickly change your pH. That's actually false. A diet takes several months to several years. And some people, it just doesn't change it at all because your body counterbalances the foods you're eating with other acidifying and alkaline buffering mechanisms, as they're called in the body. Before we go to the next slide, just an introduction for those of you just joining us or who are new. My name is Dr. Michael Wald, and I'm your host today of the 6th or possibly the 7th show in our 13 one-hour show presentation master's course on health and nutrition. You can reach me by calling me at 914-552-1442 if you want to schedule as a patient. That's 914-552-1442. Or email me for any other concerns at info@blooddetective.com. And my website is drmichaelwald.com. You can listen to this and other presentations under the blog section of my website. So a normal pH, as I've said a few times already, in the blood, that's what we're talking about, is 7.35 to 7.45, or on average, 7.4. If we have values of pH less than 7.2 or greater than 7.6, we have serious issues happening on a cellular level, which then will become systemic health problems. There isn't a health problem that you can think of that probably does not involve some problem with pH, and it's almost always that the pH is lower. Is it lower in the acid range? No, that's not compatible with life. There's something known as ketoacidosis, diabetic ketoacidosis, where those with diabetes might go into these comas because their pHs are really in the low range, even lower than 7.6, and they're in comas. So you don't have people walking around like that. But you do have people walking around with what are called subclinical acidosis with a pH of about 7.3, 7.25. And remember, that pH is what the various proteins and enzymes need to do what they have to do, like repair. So if your pH is off, either too high or too low, the enzyme function will be impaired, your healing will be impaired, disease risk and disability go up. So even a slight change in pH may profoundly affect cellular proliferation. So proliferation means the copying of cells. So as you might imagine, and listen to this, an elevation, that's an increase towards the alkaline of just 0.8 can induce a 40-fold increase in glycolysis and an 18-fold increase in DNA synthesis. So these are very adverse findings that can promote cancer. And as I mentioned a few times too, it's your circulation pH that we're talking about, and we're talking about the arterial circulation, although the venous circulation, which are the blue tubes that you see here, the pH is very, very close. So close that in hospitals, they're starting to use venous pH to estimate arterial pH because it's difficult to draw arterial blood because you have to puncture arteries. Veins are punctured when you go get a blood test. They're very, very simple. But my point is, though, that both of these circulations have to do with pH balance. And other factors that control pH, and again, I'm giving you all the right details. There's something called chloride bicarbonate exchange, which is something that happens in cells, which helps to lower the pH if the pH is too high. And then there's insulin, which could be associated with an increase or more on the alkaline end of pH. I'll just read a few of these. Various hormones tend to increase cellular pH, meaning the pH in the cell can increase being on the alkaline end. That's usually associated with the blood on the around it as being on the acid end, you see. Most of you have probably not thought about that, but most cancers seem to have alkaline pH on the outside and an acidic pH on the inside. But there are differences there. There are some sorts of cancers that don't behave that way, but most do. And then the ratio, the dietary ratio of sodium to potassium, if it were extreme, if you had a higher potassium intake in your diet, like higher plant-based diet, you will tend to be on the towards the alkaline end of pH. Now I say towards the alkaline end because you're not alkaline. You're really near the 7, near the neutral, but you might be 7.4, 7.45, 7.5. That's still mostly near neutral or on the alkaline end, but then on this end of the pH scale would be the more towards the acid side, okay? People come to me and say, Dr. Wald, I think that my blood pH is acidic. No, that they would be unconscious or dead, just can't happen. And then the last bullet here is respiration. Your breathing affects your metabolic pH, or I should say your systemic pH or your respiratory pH very, very quickly, within seconds to minutes. And so you can use breathing techniques to help your overall body pH. So for example, if you took deep breaths in and even deeper breaths out, as I mentioned earlier, you blow off more CO2, which is acid, and that will help you maintain a higher pH. If your pH is on the lower side, which happens in many respiratory problems where the oxygen exchange is poor, your pH is on the low end, and you'd want to be breathing off the carbon dioxide because it's acid, and that'll bring your pH back up, or at least it'll help. So sometimes it's a combination of diet and breathing techniques that are very important for mitigating pH imbalance. And this is just a picture of, remember I mentioned cells, they have these pumps in the membranes. This is actually a cell membrane that you're looking at on this chart. So what you're looking at on the chart goes all the way around, and that's the cell membrane. And then you see it says hydrogen ions going out. So hydrogen ions acidify the inside of the cell. This picture shows the hydrogen ion, which is also called a proton, leaving the cell. So that acid here is going out, which will make the inside of the cell more on the alkaline end, which is an anti-cancer, anti-inflammatory sort of thing, okay? And let's talk about intracellular pH a little bit more, because we're talking intracellular, the pH in the cell. That's really what you want to know. So basically, in terms of that, as the bullet number 1 here says, that the measure of acidity or the basic nature of cells in the cell, that's what we're talking about. Now, the pH in the cell plays a critical role in membrane transport. So if your pH is too acid here, it's going to trigger the membrane to let the acids out. And it might let alkaline elements in, depending on how that cell interprets the outside of the cell health towards the inside and how it will regulate that. Number 3, if an environment with the improper pH is, again, outside of the cell, if it's acid, the body will tend to be alkaline in the cell. If it's acid in the cell, the body will tend to be alkaline out here. I know these are not easy concepts to get, but just hang in there a little bit more. The last bullet here, a pH. So pH is closely regulated inside a cell in order to ensure proper cellular function, control cell growth, and other normal processes of cell health. The mechanisms that regulate pH are usually considered to be plasma transporters. That means plasma membrane transporters. They're in the plasma membrane. If things cannot get out of the membrane, in and out of the cell, you can't change the pH, the acid or alkaline properties in or outside of the cell. So the cell is made of omega-3 fatty acids, it's made of amino acids, it's made of proteins, and because it's made of omega-3 fatty acids, it can become oxidized and inflamed. So it's very, very important to give the proper antioxidants, all of these things to help the membranes, so the membrane transporters work better, so that the cell can regulate itself by getting rid of hydrogen ions, which acidify the cell, or putting more alkaline elements or hydroxy or OH compounds, I should say, elements in the cell, so that it makes it more alkaline. So pH within and outside of the cell. One more thing about inside of the cell, because it is the most important aspect of pH for this conversation. Basically, it needs to be about 7.35 to 7.45, okay? On average, 7.4. A rise, the second bullet here, a rise in pH in the cell, that's called intracellular increase, stimulates cell proliferation. So sometimes if you make a cell too alkaline, it'll proliferate too much. And by proliferating too much, it can make more errors, and these errors can be cancerous. So sometimes we need to increase the pH in a cell, intracellular pH, or sometimes we need to decrease it, depending on the entire picture of the person and all of their different health problems taken together. It's not just as simple as focusing on alkaline only. If you overdo alkaline in your blood, your body, your cells will push out hydrogen ions, those acid elements, into the blood. And it can do this over time, and it can be quite a strain on the metabolism of the cell, and cause all sorts of what are known as perturbations, all sort of regulation problems in the cell. And the cell can again become cancerous. Now let's talk a little bit more about alkaline water, because I'm reminded of a patient that had cancer who came to me sitting before me, and she was drinking alkaline water during the whole conversation. I asked what she was drinking, and she told me, and I checked the pH of her alkaline water, and it was not alkaline at all. It was actually on the very low end of pH. It was around a 7. It was about neutral, and she thought it was an 11 because the bottle did say 11, which is a high pH. She did have metastatic cancer, but by drinking all this alkaline water, she shut off her stomach acid production in her stomach. So she had malnutrition. She was losing weight very rapidly. She was doing very, very badly. So we can see how alkaline water, if you drink too much of it, will actually cause compensatory changes in the body to try to bring it more over to a regular pH and secrete all these acidic products to balance out the hyperalkaline products. I hope that made sense. The only time that I like people to use alkaline water, and this is not alkaline water, is what I wrote down here at the bottom of the slide. Alkaline water, according to me, may be a benefit in those with inflammation of the stomach, that's gastritis, inflammation of the esophagus, that's esophagitis, and ulcers, because most people take antacids for those. And antacids shut things off like permanently, 24/7. But if you had alkaline water in these cases, you can kind of control that pH, wanting to keep it on the on the higher end, because you're taking, alkaline water. You want the pH in the stomach on a higher end, so your body can heal the gastritis and the esophagitis. But basically, the reason why the alkaline water is bad is because, as I say here, it dilutes the stomach acid, just like an antacid medication. It increases bacteria in the stomach that normally should not survive in the stomach in an acid environment. And it increases the risk of infection and various bugs that we consume in our foods, which normally would be broken down by stomach acid. Now they can get right through and into our intestinal tract, causing inflammation, leaky gut, dysbiosis, the whole thing. And of course, if you're drinking alkaline water, you will induce malabsorption and malnutrition. There's just no way of getting around that. And again, we're talking about arterial pH. We're not talking about urine or saliva. If you're one of those individuals who have been told that saliva and urine are the best way to go for managing your overall body pH, it's just wrong. Like I mentioned, there are circumstances which you want to know the saliva pH and you want to know the urine pH, but they are very few and far between. But systemic level pH is arterial pH, and we know that respiration, kidney function has a major role in controlling systemic pH. So what that means is, for example, if your body's trying to get rid of acidic compounds, it'll do that sometimes through the kidneys and then therefore through the urine. By getting rid of acidic compounds, your pH, which had too many acidic compounds this direction, would start to go more towards the neutral where you want it at 7.4-ish. And then there are those membrane transporters we talked about that let hydrogen ions and hydroxyl ions in and out of cells, which control the pH of this intracellular compartment. And we're going to skip this last bullet. This is important. Now, when you have pH problems, either too acid or too alkaline, you can have all of these issues here. Number one, it says P53. That's the name of an anti-cancer gene. That gene in an acid environment, or I should say in an environment that is on the acid end of things, a pH like 7.5, 7.09, these are pHs that are just too low for the body. And what that'll do is cause DNA damage, as you can see in the left-hand first column there, which has one cell. And then next to that, it says abnormal proliferation. So abnormal pH problems will cause cells to copy too much. They make errors. Those errors make them cancerous, and then those cells copy and proliferate. And then we can have telomere erosion. So you might remember that a telomere is a cell that has a chromosome, I should say, which has a tail on it, like this banana. Where'd that banana come from? It's just there. And the telomere, as it shortens, that means your lifespan is shortened and disease risk increases. But mostly lifespan shortens when the telomere tail shortens. But when you have proper pH, you can offset or mitigate that. And then also with pH problems, you'll have hypoxic problems where there'll be lack of oxygen because the pH issues will impair the various pathways in the body which handle oxygen and carbon dioxide exchange. And even pH will cause chemotherapy to become more resistant in a person, reducing their ability to handle chemotherapy. So if someone's going to get chemotherapy or radiation, we need to make sure that the pH is correct, because if it's not, then the P53 gene is faulty, and all of these and other problems can happen. And I didn't even read all of them to you. And let me just mention briefly about hyperthermia or thermal therapy. It's a type of cancer treatment, as I've written here, in which the body tissue is exposed to high temperatures, up to about 113 degrees Fahrenheit. And the thing you need to know is that tumors cannot live in environments in these high levels of temperature, or also below pHs of 6 to 6.5. What you should know is flavonoids, which you'll find in like superfoods of their plant or phytonutrients, you'll find them in 4 products that I have on my website. I have another website, which is called blooddetected.com, which has all my supplements. And there's something called superfoods number 1, 2, 3, and 4. And I usually put all my patients on those 4 powders, about a half of a scoop of each, because it's got hundreds and hundreds of different plant elements in the flavonoid family that can not only help hyperthermia work better, but the flavonoids, when they're in these combinations, have many anti-cancer studies supporting their use. And then there's metabolic acidosis. So metabolic acidosis is when we have a lower pH. Now, this happened to be a study, folks. I know this is going to be controversial, but where the acidosis, the lower pH, actually inhibited cancer progression. It helped to slow or stop the cancer progression. Let me read this to you. So a reduction in systemic pH, again, pH scale is 0. Let me bring my little image here a little bit more. The pH scale is 0 to 14, 7 is neutral, 7.4 is where you should be. So if you have a lower pH, you're going towards the acid end. They administered hydrochloric acid, that's stomach acid tablets, and that caused, and acidic diets also, and both the tablets and the acidic diets lowered in dogs the pH to 7.3. And that caused tumor regression. The tumors started to shrink. Now, of course, it depends on the animal, it depends on the cancer, the whole complex situation with the individual, but sometimes we want to lower the pH for this reason. We don't always want to be increasing the pH. If you lower, here, try to get this, here's a cancerous tumor. If you lower the pH out here in the systemic circulation, that will tend to increase the pH in the cell. So the cell becomes more alkaline and it can die off. But you've done that by increasing the acid in the systemic circulation. The reverse can be true as well, but I just needed you to think through this. It's not one way or another. So in terms of tests to do, what blood work you might want to consider doing, this is just an image of a lab technician, and we're going to talk about blood pH and lactic acid in the blood and nitric oxide in the blood and how they relate to pH and detoxification. So first of all, let me just talk about nitric oxide. So nitric oxide blood levels you might not have heard of, but they're very, very important. Nitric oxide is a gas that's released from the inside of blood vessels, the tube. So say this pen were a blood vessel, it has cells on the outside and the nitric oxide is released, causing vasodilation. That helps oxygenation, brings more blood in, brings more nutrition delivery to tissue. So if you have low nitric oxide levels, that's a problem. But depending on the cancer, for example, or the health condition other than cancer, you may need lower nitric oxide levels, and in other conditions, you may need higher nitric oxide levels. But this one says here that increasing evidence has indicated that nitric oxide signaling, that just means talking, how nitric oxide tells cells what to do, how the signaling is implicated in the physiology of many types of cancer and chronic disease, particularly in tumorigenesis, or the growth of tumor. So particularly in tumorigenesis and cancer progression, and there's a number of different cancers here that show that low levels of nitric oxide can stimulate cancer growth. And in some other cancers, high levels can do that. And also it depends on the pH of the blood as well, because that's what you're delivering in the circulation that nitric oxide has allowed to be delivered to cells. So nitric oxide allows the membranes to dilate, and this is a tube, you see, so if it's larger, you're gonna get more blood circulation there. You're gonna get more nutrition. Some cancers like that, some cancers don't like that. Now, what's this silly little picture here? Well, the guy on the left, I don't know, but I know he's in my age category. I'm on the right. So I wanted to show you the difference between an average 50-something-year-old, okay, I was 54 at this picture, and what most 50-something-year-olds look like. And of course, it's a reflection often of what their health is like inside. So I did not get this healthy by accident. There are tests and methods in natural health care that are used to improve health span. That includes reducing risk of conditions that you might get at a younger age, but it pushes it off to a lower age, or I should say an older age. And also, when you manage your pH and your detoxification and all the different aspects of your health that we're talking about here today, you can age very differently than others. So I've been practicing these sorts of things for, a couple of decades now, and I have no physical limitations. I run marathons, I do karate, I lift weights, as you can see from the pictures. My labs are perfect. So that's not a guarantee that you can do this, but if you do some of the things that I do, you might have a better chance. So what are those things? We're going to spend some time on this slide. It's very, very important, and it's our very last slide. So I'm going to reiterate a lot of the concept that we've talked about today as well. So the blood detective approach is an approach that I put together that I have found is the most helpful in most of my patients for having them get healthy regardless of their health problems. So there's a method that seems to apply across the health span of people and the disease span of people. So one of those first things is to measure blood pH. We want a baseline of the pH, and then we want to compare that pH at another point in time. You must have follow-up pH measurements. What I like to do is if someone has an abnormal pH now, that's a blood pH, folks, okay? Not saliva, not urine, but a blood pH. If it's abnormal, I'm going to want to do that pH again in 2 weeks to see how stable or unstable it is. So if it's a let's say 2.5 now, it should be 7.4. And I wait 2 weeks and it might be a 7.45. So I'm thinking to myself, well, I have a low number and I have a high number I want here. So I better do another pH in a couple of weeks to see where that falls. Now, if that next pH, the third pH, 1, 2, or 3, comes out in between the top and the bottom, maybe this is the highest pH that you tend to go. Maybe this is the lowest pH that you tend to go because you had 1 in here as well. But I'm not super confident with that. I'm going to want to do that pH again. if I get two pHs within the high and low, I'm thinking I know your variations. If I know your variations, it's like knowing the extremes that you can do in exercise. What's the lowest weight you're comfortable with? What's the highest weight? If you have this, you can develop a proper plan. So if I know how you vary it with your blood pH, that's going to help tailor a health program to you. You never want to go with just one pH to begin a whole healthcare plan, because as you saw, there's some variations, but you want to know what those variations are for the reasons that I've just mentioned. So a pH usually at the beginning, then another pH if it's abnormal about 2 weeks later, another 2 weeks, something like that. It might be less often. It does depend on how abnormal the pH is as well. And then we want to measure capillary, lactic acid, and nitric oxide levels, okay? The nitric oxide is actually spelled with, not with an X at the end, but with a C. So again, capillary is from the tip of the finger, or we could use venous blood. And the lactic acid and nitric oxide levels should be quite, well, the lactic acid should be on the lower end, unless you've just exercised. So if you've exercised, your lactic acid levels are going to be higher because your oxygen carbon dioxide exchange systems are stressed. And if you start to decompensate, getting into the anaerobic phase, your lactic acid levels will go up. Now, what's going to happen to your blood pH if your lactic acid levels increase? So if your blood pH is here, but then your lactic acid levels increase, your pH of your blood is going to decrease because acids decrease the pH. Alkaline elements increase the pH, okay? But lactic acid obviously is an acidic product. So many of you out there are walking around with higher than normal lactic acid levels. Now, unless you've exercised within 4 hours of seeing me and when I've drawn the pH, drawn the lactic acid level, then that's an abnormal number. So that's telling me a couple of things. You could have a respiratory problem and or some problem affecting your red blood cells and their exchange of oxygen and carbon dioxide, because when that exchange is adversely affected, the lactic acid levels go up. People who are extremely well conditioned lung-wise and anaerobically in their muscle tissue, like athletes, for example, their lactic acid levels will be elevated during their exercise, but will quickly go down when they stop exercising. But also, well-conditioned people or healthier people will not walk around with as high of a lactic acid level as you might with your particular health concerns. So it's also important to get a baseline of that lactic acid and to remember that it's much more than the diet that has to do with lowering of lactic acid. If we lower lactic acid, we've lowered acids. If we've lowered acids, then our pH will come up. We want it to come up to about 7.4. If you have cancer, however, we may want you to be higher than the normal pH. Might want to get you in the 7.6 range, okay? And then as the second bullet here it says, there's the nitric oxide level. So we said just a little while ago that the nitric oxide is produced in the cells that are lining the blood vessel, that literally are the blood vessel tubes. And nitric oxide has to do with vasodilation. Vasodilation, capillary vasodilation and blood vessel vasodilation is more or less important depending on the health problem. But generally speaking, you want a higher level of nitric oxide. In breast cancer, for example, there is, generally speaking, low levels of nitric oxide. So you want to increase nitric oxide levels. One of the ways of doing that is basic nutrition focused on the arterial health or arterial tubes themselves. The tubes are made of cells. The cells are made of fatty acids, so omega-3 fatty acids. Cells that line the blood vessels can oxidize, so antioxidants are needed, things like that. But when you look at a person in their totality, there may be many reasons why they have lower nitric oxide levels. They may have severe atherosclerosis, which requires yet other nutrition. We might have to add niacin in there or vitamin E in there, any number of things, including arginine. Arginine increases nitric oxide. It's a nitric oxide inducer. So if you need to increase your nitric oxide, you might use arginine. What I did not put, oh yes I did. What I did put on this slide is the next point, number 3, in the third bullet, as a body composition analysis. When you're talking about manipulating the diet, it's important that you know what your percentage of muscle, water, and fat is on your body. Because if you don't know that, you can't know precisely the protein content that you need, and the amounts of healthy fats and healthy carbohydrates. If you wanted to stay the weight that you are, your body composition I would take it, for example, I would know what your percentage of muscle, water, and fat is. And if I'm looking at your diet is really, fairly stable, that's maintaining you there. If you want to lose weight, obviously you're going to want to increase your protein, because protein is where metabolic rate exists. And that means I would want to know what your percentage of lean body mass is, so I can tell you how much protein you need so that you have an increase in lean body mass and you're not staying the same, you see. But suffice it to say that when I recommend protein, carbs, and fats to an individual, I'm always basing it in large measure on a body composition test. It's a non-invasive test where sticky electrode stickers are placed on the hand, 2 here, and on the right side and the right foot. And this current goes through the body at a certain rate, so you don't feel anything, but it goes through slowing down when it goes through more dense tissues like muscle and organs, and fats and water is not as dense as muscle and organs. And then the differences in the penetration of the current is measured within the technology of the body composition test. And it extrapolates it out to the percentages of muscle, water, and fat. And there's other information too that tells us about the health of the inside of cells as opposed to the outside of cells through body comp. So all that stuff I was talking about the importance of the cell membrane around the cell and how things go in and outside the cell, we could measure these now indirectly with a body comp test. A body composition test, if it's a medical grade test, will also measure something called phase angle, which lets us know if the pH and other regulatory things happening inside of cells and outside of cells is balanced and is healthy. If it's balanced and healthy inside the cell, you'll have a higher number when it comes to the phase angle and a lower number as you're more unhealthy, okay? So body comp has so many different aspects of it that are important for maintaining and determining the best pH and best approach for your health. And then there is personalizing your exercise routine. Mostly when I speak about exercise to patients, I even bring it up. Most of them think they know what they're talking about, and most don't. I've been doing this for over 30 years. I can tell you that most people I speak to about exercise have no idea what they're talking about. They think that running around all day and doing things is exercise, but it's not. And the type of exercise also depends on what your needs are. But generally speaking, people would want weight-bearing exercises, not just for bones, but to maintain lean muscle mass and strengthen the heart and the respiratory system. And then, of course, doing aerobic and anaerobic exercise too, so that your circulatory system and your body's ability to manage oxygen and carbon dioxide exchange is as healthy as possible. So whatever your exercise routine is, and I go through this with patients in some detail, your nutritional supplementation and your foods are based very much on the exercise routine, plus what your health concerns are, plus what your health goals are, plus what the results of specific tests are, like your pH, your lactic acid, and nitric oxide. All of these things, including dietary logs and other screens that we're going to go through during the rest of this chart, are just some of the factors that I use to figure out how and what the patient should be eating and how and what supplements they should be taking and at what time. You know, nutrient timing is just as important as the dose of nutrition. And the dosing of nutrients are based upon a person's body composition, their amount of protein, carbohydrates, and fats, particularly paying attention to the lean mass portion of the body composition when we're talking about dosing of supplements. I cannot tell you how many times I've had patients sit before me, and for years they've been taking the wrong doses. Other patients have been taking the wrong dose and the wrong types of nutrients. Others, a combination of those things, and not exercising properly. This is not, it's not rocket science. There are methods to figuring these things out for individuals. And then the fifth bullet down, tests of vitamin and mineral use. Use, not merely levels. So what that means is there are certain tests where you can measure, let's say, vitamin B2, and that test will tell you if it's a serum or plasma level, or any of the B vitamins, for example, what your dietary intake was for the last 2 or 3 days. That's not very useful. But there are other tests of vitamin use where, for example, if you want to check whether or not your body is methylating B12 or methylating folic acid, which is an activation process, you actually can look at the size of the cells They're very big when your body's not methylating well often, and they'll shrink down to normal size when they're methylating normally. Now that's different than just measuring the levels of B12 or folic acid. Your levels of B12 and folic acid could be just fine in the blood, but they may not be methylated, they may not be active. So methylation tests are tests of activation. And the size of the cell is also a functional test of activation. If you are functionally deficient, meaning your body is not using properly your folic acid, your B12, your B6, vitamin C, E, and B1, your red blood cells tend to become quite large. And when they are larger, they're older, they don't work as well. And they cause other issues in the body. They're not going to oxygenate as well. When they break down finally, it's a strain on your lymphatic system. If your body is not producing enough cells, and if you don't have enough methylation going on in your bone marrow, then your body's forced to use these older cells, so they'll start to break down over time, and that's not ideal. And then there is the next bullet, the autonomic nervous system test. So considering that the adrenal glands have to do with your stress balance. So in other words, you have two kidneys in your body, and there's the adrenal glands on top. They're about the same size as your thumbs, and they're down in your low back area. The nervous system, the autonomic nervous system, partially controls how your body manages stress. And stress, if it's not managed well, will have adverse effects on your pH balance and your detoxification and your inflammation control and the entirety of your health. So the autonomic system means it automatically does things, so you don't have to think about it, like you're breathing right now. But since I drew your attention to your breathing, you can breathe, you can change your rate of respiration and also the depth of respiration. But when you're not thinking about it, it's an autonomic thing. Your heart is almost entirely autonomically controlled. And your body's ability to, the autonomic nervous system, when it goes to the adrenal glands, has the adrenal glands respond to stress the way it should or it should not. So if you have an issue with your autonomic nervous system, either too much sympathetic activity, which is too much stress stuff, or too much parasympathetic activity, which is the resting stuff, you're going to have problems. We need the right balance of sympathetic and parasympathetic autonomic nervous system control. So the autonomic nervous system is here. That's the heading, and it's made of the sympathetic and the parasympathetic systems. The sympathetic is the stress one, the fight or flight, and the parasympathetic is the relaxation. And we need that balance. We obviously need more parasympathetic tone when you're sleeping and resting. That allows for repair. And when you're under stress, then you might need more blood circulation, for example, and an increased heart rate. Just standing up from sitting to standing, you'll need both of those things. So you'll need more adrenal hormone, and you'll need more sympathetic nervous system activity. But if these messages are off, either hormones are out of balance or out of whack, or there's some issue with your nervous system, then these could be problems. So the nutrition to help your pH, if it is off from your autonomic nervous system problem, has to be focused on your autonomic nervous system. So at this point in time, you should be starting to think that, wow, this pH thing is not very straightforward. You know, it's not as simple as just eating acid or alkaline and changing your acid-alkaline balance. We know now that's a ridiculous notion, really, except for quick changes in your saliva and your urine. But when we're talking about real changes in your body, which reflect how all of your different organs work. Remember that slide I showed you when we started the presentation today of all the different organs showing? Each of them secretes their various secretions in this mix. So there's this orchestrated balance of the secretions of these organs so that the pH is 7.4, let's say. That's about right. And a lot of these enzymes are working nicely for repair. But when those organs, one or the other or more, are off, we're going to get the wrong secretions and the wrong pH soup, you might say. The pH might be too low, the pH might be too high, and this is why we get these problems throughout the body. Then we have lifestyle screening questionnaire. Every one of you listening to this presentation, I'm happy to send free of charge my lifestyle screening questionnaire so you can kind of assess yourself. It's divided into different organ systems. It's one of the screening tools that I use, but I may use many different types of questionnaires, but this is one that I use right from the get-go. It'll tell me information about your diet, your food, your sleep, your exercise, your medications, and other lifestyle factors. So any practitioner who's worth their salt would need to use these questionnaires and then have questionnaires specific for the patient's exact issues, as well as a generalized questionnaire, which I call a lifestyle questionnaire. So for example, if I know you have a thyroid issue, I'm going to give you the lifestyle questionnaire, but I'm going to give you a very detailed sub-questionnaire all about the thyroid so that I can really distinguish what's going on there. And through your responses to the questions that I ask in these questionnaires, an hour back and forth, I can figure out what tests are needed, when they are needed, what foods are needed, what supplements are needed, you know, the right dose of the right food and the right supplements for the right person at the right time, getting it all correct. And then I certainly would be looking at your dietary intake. Diet is obviously important, but as I mentioned earlier, don't fall into the trap of eating alkaline, you become alkaline, eating acid, you become acid. If you eat acid food like a steak, you know, cow meat, those proteins might help revitalize, let's say, your pancreas. And your pancreas makes sodium bicarbonate, which is essentially baking soda. It's an alkaline element for secretion into the small intestine. So that's how eating something acid can help you become on the alkaline end in the small intestine where you need that. And if you needed proteins, let's say, to help repair the cells of the stomach lining, which makes stomach acid, then you're eating an acid that could help you make an acid. But I think you get the idea, I hope you do at this point, that should you eat a clean diet, of course, what is that? That's a diet that's probably in the plant-based category with little or no meat, eating as low down on the food chain as possible, and doing all those things you've heard about. But then relative to your health concerns, when certain of these tests are done and these questionnaires are completed, I then figure out, well, how does that diet need to be manipulated more specifically for you? So to give you an example of what I mean here, you know, individuals might be vegetarians, right? But vegetarians are known notoriously to be low in protein, too low, low in B12, low in calcium, low in iron, just to name a few things. So that alkaline sort of diet doesn't help you if it's deficient in those areas. So I might start with a diet like that as a baseline, but then develop that diet for you based on your needs, your wants, your healthcare issues, your absorption, all the things we're talking about here, including pH, nitric oxide, and lactic acid. So, and the last bullet here is there may be testing that is based upon not just these questionnaires and not just blood tests that I've mentioned, but also comparing your regular blood work, like your CBC and your metabolic panels you get from your primary care doctors, those types of basic tests, by comparing you to healthy individuals. You know, just like I showed a picture of myself earlier compared to another individual around my age looked a lot older. I compare my blood work to healthier people. I don't compare my blood work to other 55-year-old men. I don't want to appear that way, and I don't want to, more importantly, have the health of the average 55-year-old man. And the same is true for women. So by comparing your blood work to healthy ranges, which is what I call the blood detective approach, I've come up with healthier ranges over the course of the last 20 plus years. And I use a software program that I invented to help interpret the blood, and then I compare it to these different things. And we want to push your labs into the younger area of the health, not just being normal for someone your age, because look at others your age. Who would want to be normal? So this is what you can do. That's me being very happy here, showing you a picture of me waving. And for being a part of this presentation today, I do want to offer you all a free 15-minute consultation with me. I'm just there to listen to you and to see whether or not I might be the right practitioner for you. And if not, I might refer you elsewhere. So if you want to schedule for a 15-minute consultation, please email me at my email, which is info@blooddetective.com. It's right at the top of the screen here. And let me know that you want to set up a 15-minute consultation. Also, let me know if you'd like a copy of the health appraisal questionnaire. If you want to set up yourself as a new patient with me, then you want to call me directly. So just save the calls for those of you who want to schedule as a new patient, because as you might imagine, I get lots and lots of calls, but I like to screen new patient calls myself. I don't want you to waste your time. I wouldn't want myself to waste my time too. So that conversation will help clarify quite a bit. So once again, you've been listening to the Master's Health and Nutrition 13-hour course on prnfm.com, or you can find it under the blog section right at the top and just scroll down each of those titles. You click on them, and that will bring you right to the PowerPoint presentations, and they are free of charge. There's lots of free content on my website at intmedny.com. You'll see that at the top, or drmichaelwald.com, either one. And if you want to look at my nutritional supplements, you can go to blooddetective.com. I did not add it on here, my apologies. So blooddetective.com, or my Blood Detective high quality pharmaceutical grade nutritional supplementation. So thanks everyone, and please do join me very, very soon for the next topic. All the topics are posted up on PRN and also on my website at drmichaelwald.com. It's been a pleasure. Talk to you soon.